Welcome to today's Explainer. We're jumping right into a really fascinating journey today, taking a close analytical look at the evolution of global health policy. We're going to trace this incredible unbroken lineage of public health. We'll see exactly how the foundational ideas from decades ago have matured to tackle today's massive systemic challenges. And crucially, we're going to zero in on how sustainable resource allocation, basically smart budget management, has become the absolute key to global health success. Let's get right into it.
To really ground our analysis, I want you to think about this quote from the 2019 UN Political Declaration on Universal Health Coverage. It flat out declares that health is a prerequisite, an outcome of, and an indicator of sustainable development. Now, this isn't just nice-sounding political rhetoric, right? It's a profound recognition that health absolutely cannot be siloed. It is literally the bedrock of sustainable economic and social progress. When you understand that, you really start to see why managing health systems is, at its core, about managing human and economic capital.
Now, our modern health policies didn't just appear out of thin air. There's a very clear, distinct historical continuity here. This whole revolution kicked off back in 1978 with the Alma-Ata Declaration, which was the very first to champion primary health care. Then, exactly 40 years later, the Astana Declaration steps up, reaffirms that exact same mission, and brilliantly bridges it to the Sustainable Development Goals. And of course, the whole thing culminates in 2019 at the UN General Assembly. So what we're looking at is an unbroken, evolving, four-decade commitment to global public health.
When we actually compare these historical milestones, you can really see how the global mandate has evolved. Back in 1978, Alma-Ata was hyper-focused on primary health care as the essential, accessible first level of contact, basically just getting basic care into local communities. But fast forward to Astana and the 2019 UN Declaration, and that mandate has totally expanded into universal health coverage. So it's no longer just about access anymore, it's about comprehensive, high-quality care that is explicitly tied to financial protection.
So you might be wondering, why this sudden, intense focus on financial protection in recent years? Well, the answer comes down to a really staggering reality: 800 million. According to the UN, over 800 million people globally are bearing extreme healthcare costs that eat up more than 10% of their entire household income. It's wild to think about. The system is fundamentally failing to protect the economic stability of almost a billion people on Earth.
And honestly, it gets even more devastating. 100 million people are literally pushed into extreme poverty every single year, and it's strictly because of out-of-pocket health expenses. To put that into perspective, that is a catastrophic global failure. It completely justifies this urgent, modern shift we're seeing towards strict global budget management. Because, let's face it, without strategic financing, a health system doesn't cure you, it just economically cripples you.
Now, of course, these global declarations absolutely acknowledge the massive, persistent roadblocks we're still facing to reach universal health coverage. We've got unmet health needs across literally all regions. We're battling this rising tide of non-communicable diseases, which, by the way, account for over 70% of premature deaths. Then you add in the brutal health impacts of climate change, a massive shortage and uneven distribution of healthcare workers globally, and the skyrocketing costs of modern medicines. It's basically a perfect storm.
Which brings us to our next major focus: strategic resource allocation and maximizing outcomes through sustainable financing.
To actually maximize outcomes and bust through those roadblocks we just talked about, the Astana and UN frameworks laid out some very specific, actionable financial directives. First off, nations absolutely have to direct investments straight into primary healthcare. It is the absolute cornerstone of the whole system. We also need to design compensation structures that specifically prevent out-of-pocket financial hardships. On top of that, governments have to allocate proper funding to fairly pay interdisciplinary health teams and invest heavily in the tech needed for health information systems and safe, affordable medicines. It is a highly coordinated, strategic blueprint for national health budgets. So, what does this all mean for us today? Well, we've seen the unbroken policy continuity all the way from Alma-Ata to the present day, and we know for sure that strategic budget management is literally the only way to prevent healthcare-induced poverty. So the big question you should be asking your local leaders is this: how exactly will your nation allocate its resources to achieve true universal health coverage by 2030? It's a massive challenge, no doubt about it, but it's an investment we simply cannot afford to ignore.